President Uhuru Kenyatta told delegates at the Global Malaria Summit in London that malaria prevalence rate in Kenya has been reduced from 11% to 8% thanks to continued targeted malaria interventions.
This drop in the prevalence is especially evident around Lake Victoria, where during the same period, the prevalence dropped from 38 to 27%. Clearly, this is still far too high, and our government is determined to lower the prevalence further.
He said initiatives to improve the management of primary healthcare will enable Kenya to make significant strides in delivering universal healthcare to citizens. Consequently, Kenya, in collaboration with the World Health Organization, commenced the introduction of the life-saving malaria vaccine towards the end of the year.
This vaccine targeting young children will be deployed in a pilot implementation project in the malaria endemic areas of our country.
He said the government is determined to lower the prevalence, morbidity and mortality caused by malaria by 2/3 in the shorter term and endeavor to eliminate it by 2030. The president noted that the government is on track to providing 80% of people living in malaria-prone areas with appropriate preventive interventions and treating 100% of all malaria cases in accordance to the National Malaria Treatment Guidelines.
We have just concluded one round of the mass net campaign, where we distributed 15 million long-lasting insecticidal nets in 23 of our counties that lie in malaria risk zones.
He further added that the government continues providing pregnant women and children under 1 year with nets in order to reduce their vulnerability to malaria infection. The summit on eradicating malaria, attended by 15 heads of state and government, resolved to recommit to accelerating actions to achieve a malaria-free world by putting necessary financing and policy mechanisms in place. Beatrice Getonyeng-Etich, Channel 1, Lunchtime News.